Hi, everyone. Too big to fail. How physicians can get their power back. That's what we're going to be talking about today. I'm Dr. Raval on a channel, Doc Dynasty, that is totally committed to keeping physicians independent and thriving. So let's talk about a little bit of history. Since 2018, as many of us know, corporate America has been consolidating, buying out private practices, and promising increased efficiency, increased patient access, and decreasing costs. So has that happened? No, it hasn't. I think universally now it's accepted 3 to 5 years later that corporate America is failing in its promises. So by corporate America, we mean private equity, which is banks, pharmacies like CVS and Walgreens that are buying out and employing physicians, big hospital systems, and also other private companies like OptumRx. So all of these universally are actually have increased costs and decreased patient efficiency. Multiple journals will corroborate on that. So what can we do? So if you were a business person, not just in medicine, this is a perfect time. When you see big corporations failing, it's always that businessmen and young businessmen can come in and bring back their power. And in this case, it's physicians. So what we're finding is after their 3-year contracts, which is the most common contract, physicians are leaving these companies and now having to reestablish themselves. So what can we do about this, and how do we capitalize on this? I love in Becker's Healthcare, which I read regularly, I love this Dr. James Lee Krantz's comment that to change and help physicians going back into practice and increase patient care and make patient care viable and efficient, the easiest way to do this is to give the same facility fee as you would give a private corporation or a big corporation or a hospital. Give that facility fee to private practitioners as well. That should be universal. Number two, what these big corporations ought to have done and should do is, instead of buying up infrastructure, meaning buying and owning practices, they could partner with the doctors, meaning everybody makes the same, everybody pulls out the same profit, but incentivizes doctors to move their own patients efficiently through a practice. So it's almost like corporate America is helping the private practitioner rather than being the competitor for a private practitioner. So instead of buying up infrastructure, be a partner in that infrastructure. And wherever that patient is seen, that facility gets the same fee. Number three, Dr. Michael Gomez, I also love this comment, Long Branch, New Jersey. I am a New Jersey practitioner. And like any business, he reminds us that if you want to succeed, you have to outperform and you have to outwork your competition. This is not just in medicine, this is everywhere. And right now, when big companies are failing, this is a great time for physicians to go back in who already know their patients, who already know how they want to practice, and start doing exactly that. Stay current with the news, outwork, outperform. But insurance companies can help by giving all of us the same fee. So, and let's not forget, too big to fail, this is what produced the 2008 financial crisis. We thought these banks were too big to fail. And when one such bank absolutely failed, Lehman Brothers, and then we had to rescue the rest of the banks, this is happening in healthcare as well. And take back your power, physicians, and see an opportunity rather than fret about everything going on around you. So I hope that helps. Again, Doc Dynasty, completely committed to helping physicians stay in private practice. There's a link in the bio for my book if anyone who has never practiced needs a 101. It's a step-by-step helpful guide to starting your own practice. I've been in practice 35 years, and so I hope that helps.